Hello, everyone. I want to welcome you to our monthly webinar, informational webinar for bariatric surgery in Mexico. I'm still waiting for everyone to join, and it looks like the numbers are getting more steady. So I just want to go over the raffle real quick. If you have not submitted a health questionnaire from MexicoBariatricCenter.com, please go ahead and do so and select Dr. Alejandro Gutierrez and watch the webinar to the end to be eligible to enter our raffle for $2,000 off of surgery, which we do at the end of our presentation. Again, if you have filled out the HQ before, regardless of which surgeon you have selected, you're fine. We just switch you to Dr. Gutierrez. And of course, you know, these are for the surgeries that he does perform. Every surgeon we have has a little different range of operations they do. So please make sure you have submitted an HQ by going to MexicoBariatricCenter.com/health-questionnaire/. Again, we need you to be present to the end of the presentation, and we draw the name at the end. Again, the raffle is only for Dr. Gutierrez. So if you have to get the surgery with a different surgeon for a different procedure, that you may not be able to use this. At least we keep the HQs active for 6 months. So if you have done it 6 months, within the past 6 months, you're okay. Again, I want to say good morning or good afternoon, depends on what zone you're in, time zone you're in. And I'd like to start our presentation. We're still waiting for Dr. Gutierrez to join, but I can start. So we save time. So he should be in shortly. Okay. Basically, our monthly presentation about getting weight loss surgery in Mexico is presented by myself. My name is Ron Elli. I am the CEO and founder of MBC. And today we have pleasure of honor of having Dr. Alejandro Gutierrez joining from our hospital, Me Doctor, in Tijuana, Mexico. You can ask questions by typing it in the Q&A tab in your screen, and we'll try to answer as many as possible at the end of our presentation. We also try to cover as many commonly asked questions as possible during our presentation. So please pay attention so we don't have to go over it again. So these are the topics that we are going to cover today. What is obesity and being overweight? risks of being overweight and obese. I'm seeing Dr. Gutierrez is joining us. Hello, good morning. Hi. You still muted.
Oh, there you go.
How are you doing?
Fine, fine. How are you?
Doing great.
Yeah,
Nice to see you.
I see you again.
Yeah, I just started, so I'm gonna continue. So the subjects we cover is about obesity, risks of being obese, and what does weight loss surgery do for you, and what MBC does for you. Then Dr. Gutierrez is going to cover bariatric surgery options, and we mentioned about specific bariatric vitamins, and we have our Q&A session, and then we do our raffle. By definition, body mass index or BMI is just a formula that you enter your weight, height and weight, and it gives you a number. That number basically determines where you're in this chart in front of me. Under 25 is considered normal. 25 to 30 considered overweight. And then you are looking at obese after BMI of 30, morbidly obese, super morbidly obese, and super morbidly obese. In our center, we can cover BMIs of all the way to 100, which is usually the people that are 600 or 700 pounds. Of course, this is just a formula. We all built differently. It depends on your bone structure and or your frame. This could be a little different, but that's just basically the number that everyone looks at to determine whether you qualify for bariatric surgery or not. In US, the BMI usually has to be 35 or 40 or 35 with comorbidities to qualify. In our center, we qualify you BMI of 30 plus. Some of our procedures, you could qualify for 27 BMI and higher. That we're going to go later. So obesity basically is a chronic disease that is growing all over the world, including US. And basically what is happening is our body is not used to the processed food, the sugary drinks, and all the fast food, high calorie food, and of course, lack of physical activity is all contributing to the pandemic of obesity that we are facing right now. Basically, if you look at why we have weight problem is our genetics, our developmental history, and also the environment, the modern environment we're in. All the conveniences, like we drive from our garage, going to work, coming back. We get very little activity. We're sitting at the desk all day. And basically nutrition. So lack of physical activity, stress also, lack of sleep. Sleep is a huge factor in our health, including our weight, and also the drugs that may cause weight gaining. So the notion that when we gain weight or we add fat to our body, only the fat cells or adipose tissues get larger is not correct. They change in size and the numbers, and also the structure changes. It becomes inflamed, and that structure change is causing all the problems that we see when we gain weight. Like we are not going to be sensitive to insulin anymore. So that's like diabetes type 2. We're not sensitive to the leptin in our body, and we don't feel full anymore. And also not responding to the therapies or vaccination as well as a lean person. And if you look at the right side of my screen, you see the adipose tissue or the fat cells from an obese person on top to the lean person on the bottom, that how the structure is totally changed. Obesity is impacting 40% of adults in US. Like we said, it counts with major risk factors. I like to play this video animation of when we gain weight, what happens to our breathing.
Consider this, our diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
So beside the breathing problem, you have cardiovascular problems, disease, stroke, diabetes type 2, like we mentioned, lung disease, impaired immune system, inflammation, blood clots. And when we went through coronavirus, we saw that how obesity is a major risk factor for COVID-19. And the reason is the protein in the coronavirus attaches itself to the fat cells. So the more fat cells you have more areas for these viruses to attach to. And that's why you get sick more often and you end up in emergency. So you ask, what is the cure for obesity? We all know that. The diet and exercise is just been around forever. You know, we always diet and we try to exercise to lose weight, but it's not a proven long-term solution. And we're going to go over to see why it's not. Pharmaceutical, the new injections, Ozempic, all the diet pills, the Atkins diet, all the diets that are out there, programs. Again, not a proven long-term solution for obesity. Bariatrics or weight loss surgery is a surgical treatment for a quick, safe, and long-term weight loss. And we're going to show you why. So when you go on diet and exercise, it's like a swimmer swimming upstream, and your body is going to react by lowering your metabolism, increase your hunger, and decrease your satiety. That's what happens. And here's the explanation. Because when we do diet and exercise, we're not changing our metabolic system or metabolic set point. Metabolic set point is a set point or like a thermostat that your brain and your hormones are interacting to keep you at that weight. So let's say some individual, which is I'm showing in red in my screen, weighs 250 by extreme diet and boot camp type of exercise. Let's say this person manages to bring his weight to 175 pounds. So lost 75 pounds, but still the metabolic system, his brain and hormones are not changed, interacting around the same thermostat or set point. So what happens is your body is going to react by increasing your hunger and lowering your metabolism. Wants to get you back to what the 250 pounds, which was comfortable and was operating around that weight. However, when you undergo bariatric surgery, the minute they cut the stomach and they change your anatomy, your hormones are changed. Now your brain and hormones are working in a different fashion. Your thermostat now, all of a sudden, when you wake up from the surgery, sees you at 175 pounds. And that's your resetting your set point. It resets your thermostat. And that's what the magic is about weight loss surgery. It resets your body's thermostat. Metabolic system is changed. Therefore, you're not going to get as hungry and your metabolism goes up. And that's why you lose weight quickly and permanently. Weight loss surgery is a life-altering solution to obesity and being overweight. And unfortunately, insurance companies don't cover this, or they cover it in a limited fashion, or you have out-of-pocket expenses that still is high, and paying, if you're self-pay, it's the numbers are over $20,000 in US. If you want to go to a legitimate weight loss surgery in US, you're looking at $20,000 plus. And so medical tourism basically comes to rescue. If you're uninsured, underinsured, can't afford to have the surgery where you are, you go outside, and in this case, you go south of the border to get this life-changing procedure to renew your life. According to CDC, the Center for Disease Control and Prevention, to make the medical tourism safe, you need to travel with the provider, with a facilitator that picks you up from the airport, takes you to the center, takes you to the hotel, and make sure that you are working with a quality company and see the reviews and see who they are for prevention of complications and infection. So that's what it comes down to. Also, try to buy medical tourism insurance to make sure your travel and your surgery is covered. MBC, Mexico Bariatric Center, is in the forefront of weight loss surgery in Mexico. We have over 10 years with over 20,000 successful surgeries behind us. And we provide quality medical care with VIP treatment. MBC is a US-based corporation that is located in Sacramento. Of course, that's our main office. Our mission since inception has been providing high-quality services or weight loss surgery procedures for people at affordable price. These are the reasons why you choose MBC. Our reputation in the industry, our reviews. Our packages are all inclusive, very affordable. Our surgeons are the best of the best. Our care before, after surgery. Then the range of procedures that we provide everything from laparoscopic to endoscopic, all the revisions we could do. Our scheduling process is very simple, and we do webinars, we do seminars for diet, for informational every week. Our complication rate is much lower than anywhere else. The support we offer, again, after surgery, before surgery. Our surgeons have load management, so they don't do very many every day. We are a BBB member. We are Medical Tourism Association certified. We help you with the FMLA. We have nutrition program with the nutritionist in our staff, with the surgeon liaison, and we offer optional medical tourism insurance, which we call MTI. This is a project that we started in beginning of 22 to build our own surgery center that is located near Hyatt. And we're working on this center that hopefully will be finished soon, in a month or two, maybe 2 months. This is going to just improve all the services that we are offering right now. Of course, these are just not finished yet, but this is what your room's gonna look like. Again, we are a leader in medical tourism with 10 years plus. I started myself in medical tourism in 2007, and MBC started in 2012. This is our all-inclusive packages for sleeve, bypass, DS, and gastric balloon. And ESG, basically we cover the surgeon fee, hotel fee, hospital fees, and all the tests, pre-op and post-op, nutrition support, private transportation. And again, we offer discounted medical tourism insurance optional. Our process is very simple, is 1, 2, 3. Basically, you fill out the health questionnaire and you choose, after you get approved, of course, you choose your surgery date, you pay the deposit, and we can add you to the calendar. You finish your paperwork, you get your travel arrangement, you let us know, and you're on your way to go on a losing bench. One of the services that we offer is our support before and after surgery. This is huge for long-term success, and you be joining. Actually, we have 2 support groups, one for the patient, one for the ones that are coming on board to become a patient. The one that has patients, past patients, has over 10,000 members. And this is an active group that you be enjoying just sharing your information, seeing their information, seeing how they're doing, their before after pictures, and their experience, and helps you become successful. We do have a team of our past patients, what we call affiliates, that are out there helping our patients coming on board. Judy, Rena, Dawn is not here. Her picture is not here. She actually just went down to Tijuana, came back. Sarita is more active on our Facebook, and Kelly and Megan. We don't have their pictures either. They do podcasts often. I would recommend that you look for those. Very informative. Your transportation is safe with us. We have drivers that have experience doing this for almost as much as NBC has been in business. This you see in this picture, really one of our drivers that has been with us. Basically, you arrive before noon or around noon. We pick you up. We take you to our centers in Tijuana, which is about 30 minutes away. And we want you to arrange for your departure around 1 to 2 p.m. as well. Again, if you just joined late, if you have not done a health questionnaire, please go ahead and do so. If you have, there is no need to do this again. We can switch your name to Dr. Alejandro Gutierrez. Please make sure you watch to the end of the webinar to qualify for a $2,000 off of the package. That is a raffle we do at the end of the presentation. This is one of the reasons NBC is number one, is the team of surgeons that we work with. Their specialties, their expertise that adds to what we are already offering. These are our surgeons, Dr. Miguel Montalvo, Dr. Luciana Valenzuela, Alejandro Gutierrez, which we have a pleasure to do the presentation today, Dr. Rodriguez Lopez, Jacqueline Usuna, and Dr. Jesus Ceja. Our process, like I said, is very simple. However, when you submit your health questionnaire, this is how it's handled individually and internally. So the patient submits the HQ, it goes through our surgeon liaison, which is a doctor that is bilingual, has been with us over 8 years. It goes through all of our surgeons, and it's going to the surgeon that matches the best for your situation, for your BMI, for your type of surgery, for your age. And these surgeons review it, send it back, surgeon liaison. Of course, you know, they tell you all the medications you're supposed to stop taking if you're taking medications on a regular basis, and you get your approval that way. If they need any documentation like a cardio clearance, things like that, they will let you know. Our pre-op diet is based on the BMI. The higher the BMI, the more days you need to be on. Pre-op diet is not a very difficult diet. It's just a low calorie, high protein, low sugar, hydrocarbohydrate, and basically you just stay on drinking protein drinks and avoid sugar and pasta and rice. And the better you do on your pre-op diet, the easier the procedure is on you and the surgeon. We use at this point Hyatt Place, and we do use Fairfield, Marriott. Alternatively, When you arrive, just relax. They're gonna tell you what to do next. So once you get to the hotel, make sure you get rest so you be ready for the next day surgery. The hotel provides broth, jello, popsicles, and your companion enjoys the free breakfast. On the day of the surgery, they tell you what time to show up in the lobby so they can take you to our center and get your bariatric surgery. You stay 1 to 3 nights, depending on the procedure that you go through, and we do multiple tests, leak tests, and we take you back to fly or drive back home. We were talking about why MBC, and one of the reasons was surgeons' load management. So we basically give each surgeon a certain amount of capacity per day, and we cap them at so many surgeries based on the complexity of each procedure. And that's one of the main reasons that our complication rates are less than 1%. So these are the options, procedures that we provide. I want to ask Dr. Gutierrez to take over from here and tell you all the options that we offer and start talking about the main ones that we go through in our center. Dr. Gutierrez, I'm going to let you take over. Thank you so much.
Well, thank you very much. Thank you all to be here, taking your time to be here with us. We're gonna go through a quick to see all the procedures that we do, most of the common. And if you have any questions regarding, at the end we will try to answer them all. Okay, so this a quick list of what we have. So you can see lap band. Lap band is almost not using, but there's some certain patients that it's a good option still. We have the gastric sleeve, mini gastric bypass, Roux-en-Y. We do single incisions, gastric sleeve, and more complex surgeries as a dual anal switch, SADIs, revisional surgeries, and some endoscopic procedures as well. We can go to the next one. Okay, so we were talking like right now in the U.S., 40% of the adults are over BMI of 30 or more. This year, some studies they show that in 2030, it's going to be more than 50% of the population that's going to be overweight. So instead of decreasing obesity, this is increasing. It's a pandemic. So it takes, like we've seen now, that takes like 10 years from your life. So doing this is trying to regain those 10 years and live it with the best quality of life possible. So we know we have a diet, exercise, medication, some newer medications that are helping better, but still they're under review, and they take like 15% of your weight, instead of doing the surgery that's going to take like 70 to 80% of your excessive weight at a year. Okay, so we can. Okay, so that's me, younger. Okay, so a little bit of me. We're board certified, double board certified. ACS a member, fellow. Some of me of my studies, and we've been doing this for almost 10 years. So a lot of surgeries. So good. A lot of patients. Since I was little, I always liked to medicine, helping people. I liked surgery as I was little, and And as time goes by, I got into obesity surgery, laparoscopic surgery, and we all love what we do. So patients always ask me, "Are you tired?" I tell them, we love what we do. So this is like no problem for us. Okay, to get a little bit into of the surgeries, gastric sleeve surgery is the most common bariatric procedure done in worldwide. It consists mostly of taking like 80 to 85% of your actual stomach. So we're gonna leave a tiny long portion of your stomach that looks like a sleeve. That's why it's called a gastric sleeve. So the function of it is obviously we're gonna leave a tiny portion of your stomach. You're gonna get full very fast. And second of all, that part of the stomach that we take out, mostly the fundus, it produces a lot of hormones. There's a lot of them. Most known one is ghrelin. It's called the hunger hormone. This hormones goes into your bloodstream, into your brain, and causes you that hunger sensation, that binge eating craving. So after taking that part out, your body's gonna produce much less of ghrelin. So you're not gonna have that hunger sensation anymore. As we always said, this is a tool, an excellent tool. You still have to make some changes, but this is a big push. So normally we can take like at a year after, we can take like 70 to 80% of your excessive weight. So normally it takes like 45 minutes, sometimes 30 minutes. You stay 2 nights in the hospital, and the recovery is fast. So it's a very good option. We can get to the, okay. We have some cons, maybe sometimes because of that small stomach, pressure inside that small stomach, it's gonna increase. So sometimes patients that have previously, they have like bad acid reflux, we have to differentiate, because you can have a pathological acid reflux or acid reflux that comes from being overweight, eating, stress, all of that. So we have to differentiate. But if a patient has a pathological acid reflux, so this could get worsened. So we see each patient and see if that's the problem, it's better to do a Roux-en-Y. So we can go to the next one. Okay, so a little bit of what we were talking about. This is mainly a restrictive procedure. So this part of the stomach is what we take out. We talk about ghrelin. So you're gonna have less hunger. You're gonna get full faster, and this is, well, in what what does in your body, but even what we still learning, it's like a communication between your brain and your stomach and your intestines. So after surgery, it shifts into a better you, a healthier you. So it's like that communication gets better. So that's why diabetes, high blood pressure, sleep apnea, some types of cancer, they decrease in percentage. Okay, so we have a single incision gastric sleeve. This is the same procedure, but it's done only through a single incision, that is through the belly button. So this is mostly for aesthetic purposes. Obviously, you have to fill a certain criteria. So normally we leave it for patients that their BMI not that big, their liver is not that big, and not a lot of fat tissue inside, but it has very good aesthetic after the surgery. The results and everything is the same. We have, this is newer, still developing, the endoscopic gastric sleeve or gastric application. So this is done through an endoscopy. So it has the advantages of, it's not quite a surgery, it's an endoscopic outpatient procedure. So we go to the endoscope, to the inside, and from the inside we have a special component that we can do stitches into the stomach, so make it smaller from the inside. So it it has this well, good results. Still, it's not as good as the surgery, but it's a very good option, and it's still developing. Okay. The Roux-en-Y gastric bypass, since this bariatric surgery started, it was obviously was open back at 1950s. And since then, Roux-en-Y gastric bypass, it is still considered the gold standard. At that time, obviously, it was very aggressive. Right now, we can do it through laparoscopic, and it's a very good option. This is considered a malabsorptive surgery. It has some restricted component. What we do is that gonna go to the stomach, and we're gonna cut the proximal portion. We call it the gastric pouch. And then we go to the intestine. Since the beginning, we count like around 6 to 10 feet, depending. We cut the intestine down there. We take the distal limb, kind of bind it into that pouch, into the stomach, and the other limb, we bind it into the same intestine. So it's gonna end up looking like a Y. That's why it's called a Roux-en-Y. So the goal of it is that the food is gonna go to the last portion of the intestine. So this part that we bypass is not gonna get absorbed. It's not gonna get absorbed food or calories. So as well as vitamin and minerals, obviously. But that's gonna help you lose your weight. Okay, a little bit of a difference. Well, we went to the sleeve and the bypass. The sleeve is we go just directly into the stomach. It's less surgical time. It can be revised easily to a lot of procedures. Obviously, what we commented is that if you have previously had acid reflux, so it's better to do a Roux-en-Y. The Roux-en-Y is still a little bit better on decreasing or getting rid of diabetes, high blood pressure. Obviously, if you have a gastric bypass, you can still revise it, but you don't have as many options as with the sleeve. But still, it's like a bigger push. You're gonna lose a little bit more weight than the gastric sleeve. Okay. We have another procedure that it's called mini gastric bypass, or it should be called one anastomosis gastric bypass. This FDA just approved it almost 10 years ago. So the function is it's a type of gastric bypass, but a little bit of difference in the technique. What we do is that we're gonna go to the stomach the same. We're gonna do the pouch, but it's a little bit longer. We go to the intestine, but the difference is we do not cut it down there. We take it as it is, and we bound it to that pouch. In surgery, we would call it a mega loop. So because it's like 15 to 20 minutes less surgery, it's called mini gastric bypass, but it should be called one anastomosis. It has the advantages of, instead of having two potential sites of a leak or a bleeding, it's just one. That's the proximal one, reachable by endoscopy. So we saw the first 5 years. We're almost about to do the 10 years after. This is worldwide results, and we got amazed because the results are the same or even a little bit faster than the Roux-en-Y. So it's an excellent choice as well. Obviously, if patients still had like bad acid reflux previously, so the best is to stick with the Roux-en-Y as well. Okay, so mostly it's almost the same. Obviously, in the mini gastric bypass, you can have a little bit less nutritional deficiency. Still, with all procedures, we recommend you to take vitamins and minerals because anatomy is going to be changed. So you have to keep taking your protein, taking care of your diet, and taking vitamins and minerals. Mini gastric bypass, since there's just one anastomosis, has the advantage of having less risk of an internal hernia. So shorter procedure we were talking about, a little bit less, and both of them have their indications. So when you're here, we tell you always which could be the best for you. We have the duodenal switch. This is a little bit more complex surgery, but it's like for faster, longer, greater results. So this is, it's called bilopancreatic diversion without duodenal switch. So what we do is that it's almost like a gastric bypass. We're gonna do first like a gastric sleeve, and then we do the anastomosis of the intestine, but we're gonna leave just like 6 feet, 8 feet of intestine total. So that intestine, it's binded into the anastomosis is made to the duodenum. So you still have the bulb. It has a little bit of advantage in case of acid reflux, but obviously you have more problems. You could have more problems of malnutrition because you're gonna have just a slightly portion of your stomach, a small portion, and you have to take care. Some patients could develop diarrhea, but is that you have to follow the indications and take your vitamins and minerals. But the losing of weight is greater, faster. So if you have to read cardiac problem, anything, so it's a good option. So this is a little bit of the measures that we took on COVID. COVID got us by surprise to all of us. Actually, we decided to not to return back to work until we have all measures for, obviously, for the patient and for the health equipment. So there's a small photos of what we did. Obviously, we're hoping to get this over, but still we taking measures, and this is for your health and for your better outcome. Okay. We still are wearing masks. Well, obviously I have mine here. So we before COVID, we let patients and companions stay in the hospital. After that, to lowering social distancing, to increase social distancing, lowering the amount of people. So patients are only in the hospital. We're taking tests, proper tests, and well, asking patients if they have their vaccination, if they had any problems, they had COVID, and complications with COVID. So a common question is that how fast or when can I return back to work? So obviously it's gonna depend on different factors, depending on the type of surgery that you had, your BMI, a type of work that you do. So normally we recommend to like 2 to 3 weeks in total, depending on the type of work that you do. If it's like a desk job, some patients are returning back to work a week after. So obviously, if your work needs lifting heavy things, driving bus, pulling yourself up, so we recommend a little bit more. And depending on how do you feel, we always tell patients that return back to work slowly, see how do you feel, and if not, just rest a little bit more. But obviously, well, patients are returning to work very quick. Okay. So I think this.
Yeah, thank you so much for going over our procedures that we offer. Appreciate that a lot. So we get to the financing, which I'm going to take over. Basically, we work with several lenders. We have their links on our website on the financing page. Supermoney is one. United Medical Credit, well, they call themselves United Credit now. That's a good option, e-financing. So just make sure you don't apply to too many places at one time so it won't ding your credit score. One of the pluses going with us, you get discounted medical tourism insurance. This is basically cover your travel and complication from the surgery. And it's covering you up to 45 days. Well, this says 90 days, but I think it's 45 days after surgery. And as you see, these are the limits for each claim for the total of 25,000, of course, you know, That's the maximum, but this we offer at a 50% discount only that you can get through our patients. We promise to go over bariatric specific vitamins, and Emerge is made according to the ASMBS standards requirements for post-bariatric patients. It has exact formula to cover the vitamins you need, the vitamins and the supplements you need after surgery. It comes in 4 forms of soft chew, chewable, drinkable, and capsules. Okay, so we get to the Q&A session. I'm going to start reading some of them. Can you have the gastric sleeve if you had heart failure?
Yeah, well, that will depend. Obviously, you can, but that will depend of when patients have heart problems. We recommend for them to have a cardiac evaluation, a cardiac clearance. So in that case, you have to go to do some testings, and depending on your heart evaluation, heart function, it's that we can do. Obviously, it's gonna help. It's gonna help your heart failure. But what we have to be sure is that you can be able to go to the procedure without any complication that could arise. So.
With the gastric sleeve, does the gastric sleeve increases my chances of being able to conceive? My fiance and I have been trying past 3 years with 0 luck.
Yes, it does. It increases the chance of increases fertility. So actually, there's a lot of patients that we do surgery on them, and sometimes they don't want to get pregnant, and they do. So yeah, it's proven and increases fertility after. So yes.
Yeah, I just want to make sure that they need to wait at least year and a half out to make sure the baby gets enough nutrition.
Yeah, they have to wait a year at least because your body's changing, and keep in mind that you're gonna have to take vitamins, minerals, be in touch with your doctor, but it's better to wait a year after having bariatric surgery.
Christine is asking that I have heard people being charged more on spot if hernia is found. Does MBC do this?
So, they obviously talk about hiatal hernia. This is an internal hernia that's produced in the diaphragm muscle that divides the thorax from the abdomen. This is common in overweight, obese people. Up to 30% of them can develop a hernia. That's because of pressure, intra-abdominal pressure. So whenever we do mostly a restrictive procedure like the gastric sleeve, pressure and that stomach is going to increase. So patients even have a little bit of heartburn the first couple of weeks. So if we go inside and found a hiatal hernia and we leave it unrepaired, you're going to have bad reflux after. So you will end up doing endoscopy and another surgery later on. So that's why it's better if we found one to repair it. And obviously it's because another surgery, you could say, or a little bit more time of surgery and equipment. So it's charged extra. But it will be better than living and you having problems later on.
Yeah, so I'm just going to add to what you added. One way to do the surgery is just do the sleeve or whatever and finish, not look around to see if you have other conditions that need to be addressed in the during the surgery. If they don't fix that, then you may have to go through another surgery all by itself to fix this problem. And we charge $395 extra when you have hernia. We see that average. Of course, every patient is different. Every surgeon is different, but about 35% of people need hernia repair. but with the amount of money that we charge, if you have it, it's well worth that you're getting this fixed during the surgery so you don't have symptoms later on. You know, one of the problems is developing reflux after surgery, like Dr. Gutierrez mentioned. And this would reduce because if it's coming from this area, it's not going to be a problem later on. So they're asking, how long is the gastric sleeve surgery?
Well, it takes usually takes 45 minutes. Sometimes it could be quicker. Sometimes it could last an hour, depending on different factors. But mostly the time it's like since we start and it's like 45 minutes.
So how is anesthesia done?
Anesthesia, since we do laparoscopic surgery, so it's going to be a general anesthesia. We start doing anesthesia through the IV. Okay, we give you medications to feel you to make you relax, so you feel relaxed. Then you feel sleepy, go to sleep. While you're already asleep, we put a tube under your throat and continue with gas anesthesia. So right before you wake up, we take that tube out. You won't feel it. Just a little bit of sore throat, couple of minutes, but that's how anesthesia is done.
This is a travel-related question I'm going to answer. Is this something we can do solo, or does it have to be with someone else? So basically, about 50% or over 50% of our patients come alone. And when we say alone, but from the time they pick you up from San Diego International Airport area, to the time that you get dropped back at the same location, you are never alone. You always have our staff around you, our drivers or coordinators. Of course, you know, the hospital and hotel staff are there to help you, but we do have our coordinators or patient advocates that they're always around you. So you're never alone. So really, there is no need, but it's up to you. If you want to bring your companion, you do keep companion. Of course, the first night you stay together in the hotel, but when you go to the hospital, because of the safety, the protocol that came after COVID, we keep your companion in the hotel. They come visit you, but they won't stay there at night. So really, you don't need to bring anybody. So we do help you with FMLA, which is the paperwork you need to file with your work, return to work, time off, all that, we help you with that. So basically your follow-up when you go home, it should be just maybe 3 months after, do a blood test and visit your primary care physician. But after that, it's just a normal routine. Just make sure your vitamin levels are good, your hemoglobin is good, all those blood tests is coming good. What is the general success rate for those who get bariatric surgery?
So, well, that could be depending on the success. If you are trying to lose weight and be in your ideal weight, or if you're trying to get rid of diabetes, high blood pressure, another problem. But we can say that at a year after, more than 80% of the patients they get to their goals. Still, well, as we said, this is a tool. You still have to take care of it, and we have some like a year, 5 years and more. The success rate obviously it's going to be decreasing, but that's going to depend on how do you take care of yourself.
Can sleep apnea be eliminated after weight loss surgery?
Yes, actually, it's a treatment. A lot of patients that we have here in surgery, they bring their CPAP machine, BPAP. So our goal of doing the surgery is you're gonna get rid of that machine, and sleep apnea is gonna go away as you lose weight. We went through a video of the respiration when you are obese. So that's what causes the problem with sleep apnea. So after losing that weight, sleep apnea is gonna get a cure.
As you see today, we're getting a lot of compliments about that. This is very informative, and they're saying every time they learn new stuff. Of course, we try to be current and cover the information that we see patients are looking for. Of course, every time we have a different surgeon, they all share their experience and their expertise. So yeah, it's always something new to learn. Like we said, Christine is asking, is there extra cost for hernia repair? Yes, and we mentioned that. So again, they're asking, can companion come and visit us? Yes, there is a visitation time, so they can come and visit you. Can I get surgery while taking Humira?
Yes, you can. What we recommend is that obviously during surgery you're gonna stop taking it, but as you return back home, you head as soon as possible to your primary care doctor, or to your doctor, and tell him that you had the surgery, and he's gonna be the one modifying the dose after, or taking it out if possible. So yeah, but you could still take your regular medications.
Can I still have surgery if I have degenerative disc disease in my back?
Yes, actually, surgery and losing weight in general, it's gonna help your problem with osteoarthritis, problem with disc, knees. So even now, the orthopedics are sending patients to lose weight before doing surgery like this one, in case that you need. So yeah, this is gonna help definitely.
I've heard that some people have severe nausea for weeks after. How is this treated?
So, nausea, right after surgery, nausea and pain are the most common symptoms. So we treat nausea here in the hospital with medications. At time of discharge, you're gonna have an anti-nausea medication. So that's gonna depend. Some patients do not tolerate very well the diet, or they're taking liquids or food too fast, or we recommend to do solids first, wait a half an hour, then take liquid. So something they combined it, or take a carbonated beverage. So it could be different factors. So if the nausea continues, so we recommend to head to your primary care doctor, maybe sometimes do an endoscopy, but it has to be decreasing as you get discharged. You have to have very low nausea, and it has to be decreasing each day.
So this is travel related. I'm going to cover. So basically, the way it works is you arrive before noon, and we do all the pre-op tests, everything we need to do. We take you back to hotel, so you stay in Hyatt or Fairfield the first night. We take you to the hospital for sleep 2 nights, for bypass, DS 3 nights, for gastric balloon 1 night. You stay in the hospital, and then After that hospital stay, you go back to US. Now, if you're traveling long distance or you want to stay longer, you can arrange that with your coordinator so we can make more reservation for your hotel so you can stay longer. But if not, you good to go. And yeah, so they're asking about pregnancy and PCOS again.
Yes, fertility is gonna increase, and PCOS is gonna decrease or go away, because PCOS is related to fat tissue, fat cells. So decreasing its number, it's gonna help you feel better or take that away. So it's gonna do you good.
Yeah, we see a lot of patients that with PCOS that went through weight loss surgery and they are very happy. Now about the emerged bariatric vitamins. In Canada, because we do shipment of these vitamins to you, unfortunately, the prices to ship and also to Canada has been extremely high. So I guess one of the options is to pick some up, to be ordered to go to Tijuana, and then you pick them up from there to take it with you. But it just, unfortunately, the shipment has been quite a bit of expensive after COVID. I've been diagnosed with GERD, but I don't really have symptoms. Can I still get gastric sleeve?
Yeah, well, I imagine the diagnosis was made endoscopically. So if they didn't tell you that you have changes like Barrett's esophagus, or it's not that bad, you can still have gastric sleeve because it's gonna help you. Decreasing weight is gonna decrease intra-abdominal pressure. But if you have changes, problems related to GERD, so in that case, it will be better to do the Roux-en-Y better. So it will depend mostly on that diagnosis.
How common is to have gallbladder removal after gastric sleeve?
We can do that. Right now, it's not that common. Back in the 90s, it was a condition that whenever we do bariatric surgery, you had to take the gallbladder out as well. Any condition, I tell my patients, any condition that makes you lose weight faster can develop gallstones in the gallbladder. So there's the increased risk or chance that you can develop gallstones later on in your life. So, but this is less than 25% of the patients. So we recommend for you to do a follow-up with your doctor. And if the problem arises, so you can have that surgery later on. Or sometimes patients, they say I want to take the gallbladder out as well. And we can do that. Checking on your background, and we can do it at the same time.
Is it okay to do intermittent fasting 2 weeks before going to your pre-op diet to help with portion control?
It will be better to follow the pre-op diet that we do, because if you go into intermittent fasting, you can have some liver changes, some kidney changes, get dehydrated maybe. So we recommend that you mainly do the diet that we give you, and that will be it for having the surgery with better safety and quality.
Will I see significant improvement in my diabetes with gastric sleeve?
Yes, it will. Right now, the amount percentage is that like 85% of the patients at a year after they get cured of diabetes. We've seen a lot of patients that are even having insulin, and right after surgery they don't need it anymore. But that's gonna depend on you losing weight and following your schedule with your primary care doctor. But yeah, most of the patients, they get rid of all the medications and have their blood sugar in normal levels.
Is the number of incisions is the only difference between single incision sleeve and a regular sleeve?
Yes, mostly. It's mostly an aesthetic, as we said. Inside, it could it's almost the same. Sometimes with the regular sleeve, you could have more motion. So that's why single incision is just for patients their BMI is lower. Obviously, you care of aesthetics, but yeah, it's mostly the incision.
You're asking, is there medical staff at the hotel if you have issues during recovery?
Yes, we all have our aftercare physicians. So mostly they're here at the hospital, but we contact. We have a nurse back at the hotel, and if there's any problem arises, the doctors will go and check you, and if necessary, they'll bring you back to the hospital to check you.
I had belly button hernia mesh 3 years ago. Does that affect my getting RNY?
I don't think so. Yesterday I actually did a patient with a mesh. So normally, because of the incisions are around the belly button or on the left side, so normally we try not to get into the mesh. So that would be depending on the size, but no, it's no problem. We've done a lot of patients with previous mesh, and no problem arises.
I've seen some people lose hair after gastric sleeve. What is causing it and how I can avoid it?
Well, GERD, it could be because of different factors. So it's a multi-factorial. So we've seen that patients, as they are losing weight, they don't have any problem, but sometimes they start regaining weight, not taking care of the diet, stress, different factors. So what we recommend is that you stick to the diet. We give omeprazole to patients like Prilosec back in the US. So, but you following the diet, losing weight, it's very rare that you can develop acid reflux after.
I want the surgery that has the highest chance for long-term weight loss. I have a BMI of 30. I'm concerned sleeve won't be the best tool for me, and I have a little bit of acid reflux depending on what I eat, but I didn't start until I gained weight. Is mini bypass a better option for me in terms of longer chance of keeping weight off, since that incorporates malnutrition, where the sleeve is just restriction? I was told I don't qualify for duodenal switch due to low BMI.
Yes, we have to check on different factors. Your BMI is on the lower range, so if we do like an aggressive surgery, you can get the other way and get malnutrition, other problems. So I think that if we will have to check and ask you if your acid reflux is not that common, it's not that bad, can control with medications. Losing weight with the gastric sleeve will be enough, and taking care of the diet, and that will be enough to lose weight and not having the acid reflux. But we'll have to talk it and see what surgery match you up the best.
Being a revision of RNY revision patient scheduled with you in June, do you attempt to go through the previous sites? Does the scar tissue cause concerning getting to the cavity at work? At one point prior to surgery, what revision type you decide? Is the switch most likely?
Well, that will be depending. The incision, sometimes we always try to take care of aesthetic and use the same ones, but sometimes I tell my patients, as you lose weight previously, that incisions change position. From the inside, it's the same. The organs are in the same place, but on the outside, the skin moves, so it changes. So sometimes it is possible, some other times it's not. So, but we always try to get care of aesthetics. Scar tissue on the inside. Well, if it was laparoscopic, we expect a little bit. Mostly if it's open, there's a lot of scar tissue. But we go with special care, dissecting, and when we're on the inside, so that's when we decide which surgery is best. So trying to lengthen or distalize the wound wide that you already have, and if that's the best surgery for you, not creating or causing a risk or a complication.
I have caffeine addiction and worry about withdrawal during the pre-op diet. What advice do you give to help this?
Well, we can normally we try to stay away from caffeine because it increases your blood pressure, and it can get you dehydrated. So there's a lot of patients, mostly on the Seattle area, so they like coffee. So maybe we can try it and do, well, start doing decaf. I don't know if that's gonna help, but other options than caffeine, I don't know, maybe some mood stabilizer or anxiety can help you a little bit. But maybe if you go to your primary care doctor, he will know what to give you best at that time, and we'll take care of you here.
This is another one I'm going to answer. Do you offer in-house financing like they do at other facilities? We don't offer in-house financing. The super money is probably the best option that we offer. Another thing I need to mention, we don't like to talk about, other companies, but from what I know, a lot of them actually go through different companies, but they pretend that they just in-house financing, and they have good salespeople that offer these high interest rate loans, but because they have salespeople, they make it look like it's attractive, but really it's more expensive than even going through those companies directly. But I don't know how different companies work. I know some that they claim they have in-house financing. That's how they operate. That's why we always ask patients to do your research. There was one here that was just, okay. What do you recommend if I have VSG in 2018, but didn't come near the weight loss and I'm interested in a revision? Over the years, I've gained about 40 pounds back. I lost approximately 70.
Okay, so in that case, the best revision will be to convert it into a bypass, meaning a mini or a room wide. But this is gonna help you. And actually, we do a lot of revisions from VSG, from gastric sleeve to bypass.
This is another one I'm probably gonna take over. How long after gastric sleeve surgery can you have cosmetic surgery? So basically, we recommend at least 1.5 years. Basically, you want to wait until your weight loss is stabilized and you're not losing more weight, and you are at an ideal weight that your goal weight is reached, and that's when you want to get the cosmetic surgery. And some people want to rush it to do it faster, but that's at least 1 to 1.5 years. That's what we recommend. Is it more beneficial if you remove gallbladder before your weight loss surgery?
Not more beneficial, I could say. Right now, it's not done that commonly. It will prevent you from having another surgery later on, but as I said, right now, patients, just like a quarter of the patients, can develop a problem later on. So it's not an indication that we have to take all gallbladders when we do a bariatric surgery. So it will help you only in case that you will skip one surgery in the future that you could have any problem.
By the way, a lot of the questions I see, including incision care after bariatric surgery when you get home, Mexico Bariatric Center.com has a lot of information about do I qualify for surgery? What is the difference between VSG and bypass? Bypass and mini bypass. Which surgery option is good for me? Sleep apnea. Vitamins, pre-op diet, post-op diet, hair loss. All these are covered. So you just have to go to MexicoBariatricCenter.com and search for things. Let me show you here because I'm sharing this. Yeah, we do have quite a bit of information online. You just go to here and type, let's say we type sleep apnea. There are multiple articles about teens sleep apnea, about how bariatric surgery helps the sleep apnea, about sleep in general. And, there's so much information here that about our success page where you see past patients' success stories and before after pictures. And so there's a lot going on here. So you may want to explore that. Is anesthesia handled differently if you have sleep apnea?
During surgery is the same. It doesn't. Right after, some patients could be held with or need a CPAP machine. So we recommend that they bring, if you bring yours if you have one. If not, we have here in the hospital. And but no, only if needed at first. But later on, anesthesia is the same.
Today, we're getting a lot of compliment. Thank you so much for, first of all, sharing your time with us and asking questions. It's a pleasure to answer them. What would cause the need for revision other than GERD?
Most common one is regaining weight or not getting to your goal. So mostly is right now is gaining weight and acid reflux. So those are the most common symptoms or causes that make you get into a revision.
How soon do you start see the weight come off?
Well, since you're gonna see it since your pre-op diet. So right after, well, the first couple of days, because we do a lot of liquids, medication, maybe it's not that you cannot see it that well. But a week after, patients are seeing the weight decrease. A month after, and it goes through a year. Sometimes you plateau a little bit, but the first year you're gonna see lose that weight drop very fast.
They were talking about they were asking about the bariatric vitamins. So you can basically order the vitamins when you are completing your consent form, or go online on Emerge Bariatrics and order it. So when you get home 2 weeks after, you can start taking them. Again, this is a very crucial subject, that you get enough nutrition and supplements after surgery. So losing weight is, of course, is a idea that you want to do this procedure, but you also want to have a long-term success. Long-term success means maintaining that weight with activity, with diet, and not have lack of nutrients, so you would not have bone density problem long term. You would not have nerve damage. So that's why we recommend you take Emerge, so you have this long-term success. You lose weight, but you also stay healthy 10 years down the line. I believe the companion, there is a package of 249 that covers for transportation, hotel, all that. So Deja is asking, does hyperthyroidism meds like methimazole affect weight loss surgery?
Well, actually, surgery is gonna help with hypothyroidism, and even your dose of medication that you take, methimazole, it has to decrease. So well, thyroid, it controls metabolism, so it's getting your metabolism improved. That's gonna help your thyroid as well.
So we were talking about companion. We do see a lot of people coming as a buddy, whether they're husband and wife, their friends, co-workers, they come as buddy. First of all, you get a buddy discount. Also, you share room, you be close to each other, supporting each other before and after surgery. And of course, when you go back to be on the same diet, be on the same wavelength, and that's really the way to go. So about the vaccination, we don't require vaccination for COVID. Of course, that's a great thing to do if you have it already. Sometimes we use a surgery center that they require vaccination or PCR test, but normally we don't. We do recommend, highly recommend you do the test before you come for yourself and companion. Make sure you're free of COVID for your own good and everyone else around you. So yeah, and another thing I wanted to mention, I don't know if anybody asked, but we do require you to bring passport book or passport card to make sure it's an easy transition coming back to US. You can bring cash or credit card, either way. They take dollar, most of the places in Tijuana, because it's so close to the border. Actually, when you cross the border, for people who have not been in Tijuana recently, you are entering into a high-end, highly commercialized business zone, which we call Zona Rio. And all of our facilities and hotel, everything is located near the border and is quite safe and quite pleasurable. And they speak English most of the time, and they take US dollar. Will gastric sleeve resolve fatty acid?
It's going to improve as well. Fatty acid is a step, or you have some steps, and they could lead you to a cirrhosis. So having the surgery, losing weight is gonna take that fatty liver. At first, obviously, you had a lot of changes, or if it's too big, it's not that change. But yeah, it's gonna help improve.
So when you lose weight, you may actually have loose skin. Some people may have loose skin already because they lost some weight. And then of course, the rapid weight and your genetics, the way your skin is, how what your age is, you can actually have loose skin after you lose all your weight. And we do offer MexicoCosmeticCenter.com, which we work with post-bariatric patients, certified surgeons, because not every plastic surgeon can deal with post-bariatric patients. Post-bariatric patients have certain requirements that not every plastic surgeon can handle. So you can look in MexicoCosmeticCenter.com, and we will be more than happy to get you in with our plastic surgeons. My friend got sleep and says gas builds up in the chest and is painful. Why does gas build up in the chest?
More like gas is like your stomach is gonna be decreased, so you're gonna have a small portion of your stomach. So you will have to learn like to eat slowly, to bite better, to separate liquids from solids. So this happens sometimes when you eat like too fast, and well, the stomach it fills up, and sometimes you have some trouble, your esophagus passing through the stomach, so it causes you that pressure. So they have to be I have two African physicians that we made surgery on them, and they lose a lot of weight, but sometimes they eat like too fast, or because of time, and they're like bumping themselves. So maybe it will be like seeing what you eat. Some food are very dry, so, and eating slowly. So that could be the problem.
This patient is asking, I'm currently BMI of 35.9. During the next few months, if I lose weight to go below 35, would I still be a candidate for RNY?
Yeah, well, that will depend on different factors. So at the time that you're here, we talked to you prior to the surgery, and we see your background, your concerns, what you expect from the surgery, and depending on those, we recommend which is the surgery for you at that time.
I had the sleeve and I got approval through you all for bypass. My question is, I wasn't able to do protein shakes before nor after surgery due to my severe gout I have been battling most of my life. It actually didn't seem to do any that, but how will I get the many with this issue? If I take anything high protein, mostly liquid it goes through my system quicker. It gives me the worst gout flare in both feet, ankle area.
So yeah, well, this is a special type gout. and obviously gout is from uric acid, from protein. So there's some special protein if the normal doesn't fit for you. But yeah, at first you have to take care of what you eat, decreasing protein, some other type of protein, and if it doesn't help, there's some certain special type of protein that could help you with that, and decreasing uric acid from your blood.
So they're asking, I had ESG procedure done a while back. Do you do a revision to tighten the sleeve back to its original shape?
It could be if you want to, or we can, sometimes what we do is that we do a revision and we do a gastric sleeve. We do an upper GI endoscopy prior to see the stitches. Sometimes the stitches, they dissolve. So, but we can do a gastric sleeve on top of that.
They've been asking about IV treatment after bariatric surgery. They're saying, is there IV bar or IV treatment? It is a good idea after procedure.
Normally, if you're taking liquids, good, not having problems. So normally we do not, you don't need it. It doesn't do you any harm. But if you're taking liquids, and we prefer always the oral via. So if you want to do it, you can. But if you're tolerating liquids, no, it's no special need.
Do you record the surgery? And if so, would I be able to take a recording home with us?
Yeah, sometimes we record it, and if so, we'll see. Normally, well, long ago we recorded on DVDs or CDs. Now we don't. The technology is different, but maybe we'll see if that could be done.
We really appreciate you guys today. We're getting so much compliment. Thank you so much for the compliment. So Fabiana, let's see what Fabiana knows. We're trying to answer as much as we can. We still have 48 open. So Fabiana, when you do the health questionnaire, Fabiana, there is the option to say which surgeon you choose. And sometimes based on your procedure, you may not get a certain type of surgeon. So if that's the case, that means that surgeon doesn't do that procedure. But you should be able to select a surgeon, and sometimes you can leave it blank and we assign a surgeon to you. But in the HQ, you should be able to select a surgeon. And if not, that means for that procedure, that surgeon is not offering services. And let me put this. We did say MexicoBariatricCenter.com/health-questionnaire. Sure, type it right. Okay. Okay, so about the flights, yes, our packages do not cover your whether driving or flying to San Diego. That part you take care of. We just, once you arrive to San Diego International Airport, that's when our services starts. And of course, the whole trip, and we bring you back to the same location. our timeline right now is not too busy. We still have some openings in the coming months. Again, just fill out the health questionnaire and we'll let you know what is the availability, but it's not too bad. I have spinal simulator in my mid back that the wires are in my neck. Does that cause any issue with sleep?
No, no problem. We were able to do it, to give anesthesia without any problem. We have some patients that have it, so we can do the surgery normally.
Sorry, I'm just reading the questions, make sure we are getting to the bottom of it because we are going actually over 1 hour, 45 minutes. We love to spend more time with you, but some people have they have scheduled their time to be with us for so long. So I think we are let me see. Yes, so one of the ways you can do your own financing is to pay the deposit, book your surgery out. And once you are on the calendar, you can start paying as you go. A lot of people I see do that. Maybe they send $500 every week or 2 weeks or $1,000, and they make payments toward the surgery until the surgery date, and they're all completely paid. This way you're disciplining yourself and you're not requiring any financing. Okay, so we get to the end of our presentation, and as we promised, we're going to do the raffle. I have all the names that people who did do the health questionnaire, they qualified, they attended the webinar to the end. So I'm going to draw one name from here. And let's see. Amanda Sigati. I hope I didn't mispronounce your last name. Let me see if I can find you here. There we go. I'm gonna let you talk. So this is the winner of today's. Hello, you are muted, Amanda. We can't hear you, Amanda. I'm letting you talk. So if you want to share your story or talk to us, you need to unmute your device. Anyway, you can call our office and make sure we get you on the calendar today. Again, Amanda, thank you everybody for attending. We'll see you in our next webinar, which probably will be 4 weeks, okay? Thank you so much. We appreciate you. Thank you, Dr. Gutierrez, for helping me, and we'll look forward to seeing you. Goodbye.
Have a good day. Thank you.
You too, goodbye.
Thank you so much.
Oh, okay, I see you now. How are you doing?
I'm good. Sorry, I couldn't figure out how to unmute on my cell phone until now. So that's great.
So tell us more about yourself. Where do you live? How did you hear about us?
Yes, I'm from Edmonton, Alberta.
Wow, great. Okay.
Love it. Yes. I have some friends who have had the procedure, so I was thinking about it. And in my research, you guys just kept popping up. And so I've been joining chat groups and just kind of seeing like the feedback on your center and the doctors. And yeah, so really, really happy to be part of the chat today and looking forward to booking and solidifying.
Yes, yes. Just call our office. I will let them know, and they would also reach out to you. We love Alberta. We've been up there, you know, Calgary, Edmonton, all that areas. Before COVID, we were hitting those areas, and we loved it when we went up there. So hopefully,
Awesome.
we get to come back. But we look forward to seeing you down there. And thank you so much for attending our webinar. I appreciate you.
Thank you.
Appreciate everyone. Dr. Gutierrez, thank you again. And we'll see you soon. Bye-bye.
Thank you.
Thank you.
Bye-bye.